So how to get rid of the fat? So this is very important topic because you are doing lot of exercise, you are doing gymming for last 5 years, 10 years, but you are not getting rid of the stubborn fat. He is a young patient around 30 years going to gym, but now he has come to me to remove the fat. And I assure him the complete removal, as you can see in the picture, from the love handles and the back. But in the upper abdomen, so there is a component of the visceral fat. So you can see there is a subcutaneous fat which is pinchable, but again there is some visceral fat in the upper abdomen. So it is very important to examine you before the liposuction. As you can see in this male patient, when I touch the skin, I assess the amount of the subcutaneous fat that is pinchable and the visceral fat which is inside, which cannot be removed by the liposuction. Second thing to assess is whether your fat is harder or softer, because I have three types of liposuction machines. So Kyra Clinic is among the very few clinics in which we have all the technologies of liposuction to be used wisely, changing for every patient. So it is not the one key for all the locks. So we have to change our technology according to the type of the fat. So if it is a harder fat, I always use the ultrasonic or the laser liposuction to melt the fat, to liquefy it or emulsify the fat. If the fat is on the softer side, the more technology, advanced technology is the water jet liposuction, and last is the safest technology, that is power assisted or the micro air liposuction. So I have to assess what type of technology is to be used in that patient. Second is your tone of the skin, whether your skin is loose or it is younger, because like a rubber band, when if your rubber band is stretched, you leave your rubber band, it will go back. So that is called the skin retraction. Or you understand, after pregnancy, after 9 months childbirth, your skin will go back. So that is your skin retraction. Your skin retraction is better if you are a younger age group and if you have got a very good skin tone. But if you are an older patient, you have a lot of stretch marks, you have lost a lot of weight, then your skin tone is not very good. So I have to assess the skin tone. And third thing is about the skin tightening. So for last few years, the plastic surgeons all over world, I go for many international trainings, we are using the body tight skin tightening. So this is the advancement, because when we remove the fat, the skin has to go back, but if skin quality is not good, we do the body tight skin tightening. This is another procedure we do along with the liposuction to make the skin tighter so that it retracts back very easily. And last thing is the marking. So I have to see if there is any indentations, I have to avoid that area. So where there are more bulges, what is the amount of the fat to be removed from each area. So all this assessment is very important in the pre-operative markings. And last thing about consultation or marking is to give you the courage or to give you a hormonal boost before the surgery, because if I am confident I can give you the results, so you will be happy even before the surgery. Thank you.
Yes, in liposuction procedure, the first step is giving anesthesia to the patient. He can opt for the local anesthesia if it is a small volume liposuction, or the second is general anesthesia, in which the whole body is anesthetized, and we always have a board certified anesthesia doctor with us during the procedure and after also. So after giving the anesthesia, so we have to do the fluid infiltration. So that is, we give a fluid that is normal saline or ringer lactate, in which we give some local anesthesia, some adrenaline medicine, which will decrease the bleeding. So we fill the abdomen roughly with around 1 to 2 liters or 3 liters of fluid. So that will disperse the fat globules, that will do the vasoconstriction to avoid any bleeding chances during the procedure. Then we wait for 15 minutes after we put the fluid. So this is the preparation. Then second step is we aspirate the fat. So with this cannula, so these are the special cannulas and the special machines, and there is a suction tubing which sucks out the fat. With the help of this cannula, we are moving this cannula to and fro in the subcutaneous plane to remove the fat. You can see the fat has started to come. You can see this is the amount of the fat. So this is how your fat looks like. So this is just after 3 hours we have removed 2 liters of fat in one jar. And this is 1500 liters of fat in another jar. So total it is 3.5 liters. So we have been able to achieve what we aimed for. So this is from the love handles and from the abdomen. And now we will wait for the best result for 4 to 6 weeks for the skin to retract back, and he will be happy to see his new result.